Medicaid Matters in a brief statement.
My son just loves to make people laugh, and he makes me laugh every day. Even when we're on the phone, I always leave a phone call with a smile on my face because he has made me laugh one way or the other. He doesn't get his medication. He's out of control because of the medications that he's on. Keeps him stable. It keeps his anxiety down. He also takes medicine for nightmares. Because he's adopted, he has the Medicaid, so I don't have to renew it. I would have to get a full-time job and a part-time job to pay just for his meds alone if I had co-pays.
About 1 in 3 people in Rhode Island are covered by Medicaid. It's a federal state program. If the state spends $1, we get a dollar back from the feds or a higher amount from the feds. So it's bringing into Rhode Island's economy $1.4 billion in federal funds. It supports the system that we all rely on. So if I need to go to the hospital, I use my commercial insurance card for my job, but if the hospital didn't have Medicaid monies flowing into it, maybe the hospital wouldn't be there.
It would be really hard to fund the clinic we currently have because most of those patients do receive Medicaid, and while we are able to provide some care for free to those patients who don't have insurance, partially that's because there are other people who are receiving insurance. For a lot of people, it means the difference between life and death. Without insurance, people aren't going to survive.
Medicaid provided me with the treatment. It covered all the treatment that I needed to have, and took that huge worry off of my plate because there's so much more to worry about when you're facing your mortality. And I like to refer to it because it's honest that it literally saved my life.
Medicaid helps with many different aspects that would help more get into the community through medications. They help with the medications and they help with doctor appointments. And without that, those little things that save, it does end up trickling down to the way one can get access into the community.
We think of this as there being this upfront cost that we're paying for all of this care that otherwise we wouldn't have to provide, but the sicker people get, the more expensive it becomes. And while we really want to be thinking about it mostly from being able to provide good care for people, we also have to imagine that we're probably saving ourselves money by providing the care before things get out of control.
What I want to say is Medicaid matters because poor people's lives matter.
I would not want to have to worry about putting food on the table and his medicine at the same time. I just can't do that.
One medication I take helps calm down my shaking, so it'll throw up. So the shaking won't just be in my head; it'll be throughout my body, and then it makes me fall. And then I've broken fingers or broken toes. Then Medicaid helps with that. But if Medicaid wasn't there, then it's like a whole bunch of little things taken out of a big piece. Like say a snowflake or something. It's not just a big round ball. It's got those little holes in it, so it's very fragile.